Okay, so we're comfortable with the top toolbar, the main menu options, and now we're going to look more specifically at each patient panel, right? So on the left here, we have this whole subset, and depending on which software version you have or whether you have the add-ons, you may have probably just these top 8 panels. You may have some of the more advanced guided stuff and model editing things, but we're going to talk about these top 8, the most common that come with the main license. So when we first come into our scout plane here, we have a couple options, and as you see, every panel is going to have options just to the right of the panel screen over here. So in the image wizard, when we first enter, this allows us to do some trimming and some filtering and change some things around if we need to. So if we wanted to, for instance, say just focus on one half of the patient's CT, we can turn on our trimming, and these yellow bobbles can be clicked and dragged. And what we'll be doing is actually trimming away whatever portion we don't want to see. So let's say we just want to focus on the patient's lower left, jawbone without the teeth for some reason. Okay, we could do that. And when you do it, you simply click permanently trim. Now, that's not going to delete the file from the database or your computer, but for the rest of the project you're working in, you will not be able to reconstruct whatever you trimmed down. Okay, so just important to know. If you wanted to trim, that is how you would trim it. Okay, so we'll turn that off for now. You could also do minor sculpting to the 3D rendering, which is generally not needed. And there's some image filtering here too. Let's say that we want to flip the axis on this patient, flip the x-axis, we can flip the y-axis, we can flip the z-axis. Okay, so these are different things. Maybe we imported this scan from a different type of CT and it comes in 90 degrees or it's off somehow in that dimension. Okay, so that's the main panel here. And there's a couple ways to handle these panels. Most of the time we can just hit next step. And so we can treat this almost like a wizard that's going to take us step by step on how to read the image. Personally, I like to take an initial glance at the CT at this phase before I go into importing data, drawing the CPR curve, and so on. So I'll show you quickly how I do that. First things first, I will take and click and drag up until I'm about even with the hard palette. And I will drag down by clicking this little angled bit. So if we click anywhere, it's going to orient all of our images to that spot. We can also click on these small arrows to allow us to change the angle on some stuff. So what I'm doing is I'm putting my red line, which is my axial plane, and you know that's the axial plane because notice the red outline of this window. So as we hover over it, the entire outline of the window is red. And so that's denoted in all the other views as a red line, okay? So similarly, here's a blue line that's going up and down the coronal slice, and the upper right panel has a blue outline. So that tells us kind of where that is. What I'm doing is I'm setting the axial slice to be level with the patient's occlusal plane and generally to be level with their horizontal anatomy. And the reason being is when we do pathology reading, generally in the axial slice, as we work our way down from the top of the patient's head to the bottom of the scan, we're looking for asymmetries. That's the most easiest way to look for pathology, right? So we want to set up the patient for that scan in this initial read to find those asymmetries. So I use the hard palette as a pretty good marker for a horizontal plane on the patient. Now, as far as rotational planes, I will come to the patient's, if we come up to the palate, we're looking for the nasopalatine canal, and I'm going to click right in the middle of the nasopalatine canal. And then I find the nasal spine, which is the midline of the maxilla, and I will just turn my sagittal slice to be right in line with that. So now I'm pretty comfortable that I've got the correct horizontal plane for the patient, and I've fixed any minor rotations. So this just means the patient was put in the machine, positioned maybe 5 millimeters, turned to the left. Very minor, but something that I'm just going to correct here very simply, okay? Now, to take a quick pause and work around how we navigate these images, if we're holding our mouse button and we're clicking with our left mouse button, so the standard mouse button, that's going to click and change the views to wherever I click. You can also click and drag, okay, and that you'll see, like for instance, the lower right in the sagittal slice, we're actually going through the slices as I click and drag, right? If you click and drag the right mouse button or the off mouse button, that can zoom in and out. So clicking, holding, and going back and forth with the mouth, zooming in and out. And that works on all the panels, whether it's 3D, sagittal, coronal, etc. Okay. We also have these sliders on the side of our panels. So here, this one that says 93, I can click and drag, and that's going to quickly go through the slices of that screen. And you can see on the lower right, you see the red line going up and down on the right side. So we're just scrolling through those slices. You can also use your mouse wheel if you want to go very, very slowly and you're looking at something more distinct. But generally, for a general read, it's nicer to do something a little bit faster. Okay. Also, on each of those screens, on the top left, you have a mini toolbar. And so the top leftmost one has these 4 arrows pointing out. If you click that, it will full screen whatever that panel was. And if we click it again, we'll go back to whatever our layout view was. So we can do that on all of them, right? We can full screen the 3D rendering. We can full screen the coronal slice, etc., etc. There are also slices next door in the toolbar that says 1-to-1. These are different viewing panel option layouts for the individual panels. So not just the layout button for the general layout, but you can even change the layout for these individual panels. Okay, and that might come into play more when we do some implant planning. For now, we'll leave it at 1-to-1. MPR and all these different ways of looking at slices, and this will come into more effect when we talk about our CPR curve or our panoramic reconstruction. But if you play around with those, you might see that you have it kind of might make things a little bit more visible. But generally for this scalp plane view, you want to keep things in MPR, which is the single slice thickness. We can change the thickness of each slice. So this is 0.2, that's in our extended volume, that's the size of our voxel, right? So each slice is 0.2 millimeters thick, and that's the easiest for reading for pathology. If you wanted to change that and make it, this is more useful for panoramics, but you can change the thickness of each slice if you so chose. Okay, so let's go ahead and do our initial read for this patient. And how I'm going to do it is by grabbing onto these sliders, and I go all the way to the top. Okay, and as I work my way down, I'm taking a look at this axial slice. Let's zoom in just so we can all see. I'm going to take a look, and I'm looking for asymmetries and things that might pop out at me, right? One thing we notice, for instance, is a little bit of mucositis in the sinuses. The membrane, there's some mucus or some inflammation in the membrane that's lining the sinus. All right, as we scroll down with our mouse wheel, now we start to see the roots come into play. There's a root canal. Okay, and we're just looking generally at for asymmetries. We're not getting too specific. As we come down to the mandibular teeth here, we can see some large caries perhaps. Looks like a recurrent decay under some sort of amalgam or metallic filling. Another root canal here, and here's an edentulous span where we'll probably try to place an implant later. Okay, and so that can be our initial read. And you can do this when you get comfortable pretty quickly. Okay, so we're going pretty quickly. We're looking for any abscesses that pop up. There's some caries. We see an edentulous site. We can see the mental foramen and where it pops out there, right? So here's our mental foramen on this view. We'll go back to full screen. And now let's go through the coronal slice. So let's center the coronal slice. We'll grab this toolbar. We're going to go all the way to the front. Here's the nose, lips, and the front teeth. And as we're going back, we're getting a really nice view here of the mental foramen, the depth of the IA nerve, the general outline of both jaws. And we can see, this is a very tall patient, but we can see portions of the nasal cavity and then obviously the sinuses as well. Okay, we can go back and here's our edentulous span where number 19 is missing. Okay, great. And then we're going to go to the sagittal slice and we'll pick a side. So we'll go all the way over to the patient's left. There's the edentulous site number 19. And here we get a really good view of the anterior teeth, right? Make sure there's no trauma or abscesses in those anterior teeth. There's the nasopalatine canal. Okay, great. And we'll come all the way over to the patient's right. And there's the caries that we saw earlier as well. And then lastly, we can certainly take a look at the 3D rendering, not diagnostically accurate for caries or abscesses or anything like that, but really nice for gross anatomy, right? So now we can see much more clearly where the mental foramen is, as far as which tooth it's under if we're doing surgery down there. We can get a general idea of where the infraorbital nerves maybe come out. This patient actually has 2 mental foramen. You can see this accessory mental foramen here on this patient. So nice to be able to see that kind of stuff. Here we can spin the patient around, get an idea of where the genioglossus attaches, right, and where the sublingual artery and anastomoses. And if we flip them up, we get an idea of here's the greater palatine foramen if we're doing like a V2 block or a GP block, right? So nice to be able to see the gross anatomy. Also, while we're in this screen, at the top toolbar, and we'll go over this in a little bit more detail in the next panel, there are some presets. So here we have one that says X-ray. This changes this to look a little bit more like an X-ray. We have the one that says bones, and this is the default. So this is just the default rendering. Soft tissue, which will show us some of the soft tissue, right? So here we can see the patient's lips and their chin. And then we have this one, which is for teeth. And so this showcases more of the enamel. You'll see metallic objects, root canal fillings, crowns will really pop up with this. Here you can see the root canal filling on 18. And then lastly, you have this X, which just toggles off and on the rendering, okay? All right, let's go to our next panel, which is 3D settings, and we'll talk a little bit more about those rendering settings.